The college Monty Vincent, so there's a very clear path that all these nursing students went through.
Right.
So I guess explain that part, which is that you do first 2 years of certain prerequisites, and then you start clinicals, right?
Yeah. So, I mean, I had a different route because I did
very different.
very different routes. So,
Okay.
Good. That's good. Yeah. We can talk about the differences. Yeah. So what
if
was
you
yours?
want the traditional route, it's 4 years in nursing. So your first 2 years, you're doing your prereqs, you're doing your recs for the college, regular courses, and then the last 2 years, you're doing the clinical portion, and you're going to different sites, different hospitals, and everything. And then after you do your 4 years, you can choose to work, or they have bridge programs where you can do your master's degree.
Okay.
And that's where you're going to pick what MP school you want to go to.
And how long is the master's program?
It depends. Full-time is 2 years, and part-time is 3 years.
Okay. All right.
And after that, you have to get a board certification. So you're not just getting a license, you have to get a board certification.
What's the difference between the two?
So the license is you're able to work. Your certification shows that, how will you explain certification?
It just shows that you're competent enough to practice, not just to graduate school, but you're competent to practice at a certain level.
Okay.
Yeah.
And so that was your path.
That was my path.
Okay.
Yeah.
And then your path was different.
Very different. I went to junior college. I went to Long Island College Hospital School of Nursing. I got my associates in nursing. After I did that, I worked for a few years, made some money.
Cash money.
Love money.
Capitalism, baby. You gotta make money.
And I got my bachelor's online. It's not 100% online because there is the clinical portion of it. Right. So there's like a year where you have to, you got to go to like sites, whether it's an ER, wherever it is that you end up, you pretty much meet, you do these hours, you fill it, you write like stuff about what you did.
Okay, like any internship.
Yeah.
Do your hours, write about what you
During
did.
those clinical hours, you're a nursing assistant, something like that?
No, you're pretty much a student.
You're
just
a student. Yeah. You're like a nursing assistant. Yeah. Because you can't really touch the patient, but you're like kind of propping the pillows and whatever they need. But you're at the same time learning from the teacher what to do.
Yep.
Got you.
Yeah.